Marijuana is not the pot of the past. The industry has refined the product even since voters passed Amendment 64, and lawmakers say regulations have not kept up with that. Political specialist Sean Boyd joins us live to explain some big changes when it comes to medical marijuana. And Sean, these are aimed at young people.
18 to 20-year-olds, Karen, who don't have medical problems but are getting medical marijuana cards and not only using pot but selling it to their younger friends. Pot with 80 to 90% THC that some doctors say, is leading to addiction, psychosis, and even suicide. The bill would make it a lot harder for those young people to get medical marijuana and would limit how much they could get each day.
My wife and I have struggled with our son with high potency concentrates.
At a press conference to roll out the bill, lawmakers shared personal stories of the impact of high potency pot.
I have a nephew who journeyed down this path using high potency products while he was in his early to mid-teen years.
They say Colorado led the nation in legalization of pot and now has a responsibility to lead the regulation of it, especially when it comes to those between ages 18 and 20. The bill would require an in-person exam, including a mental health review by 2 physicians in 2 separate practices, and follow-up appointments every 6 months. The doctors could only prescribe pot for problems they are trained to treat, and they would have to specify the potency, dosage, and daily limit for each patient. The bill also requires concentrates be sold in 1-gram packages, limits sales to 2 grams per day, and enforces it with real-time tracking of the sales. Connie Boyd among those supporting the bill. Her son is in a nursing home, she says, with cannabis-induced schizophrenia.
The whole process of this bill will create an awareness that people have to understand. I mean, my son actually was invited to smoke pot at 15 in parents' homes of his friends, and they got high with him.
I lost my child, and I understand that. I do, and I want to stop it. But it is very challenging to help people understand the difficulties that this presents.
Stacy Lynn says the bill will help some kids at the expense of others, like her son, who relied on high-potency pot for severe medical issues before he died.
Most people, these are lines in a law, and they're statutes that look good. But this is our life.
The bill does make exceptions when it comes to those daily pot limits and those in-person doctor visits for young people with severe medical issues. Still, opponents say it will hurt access and affordability. One thing both sides do like about the bill is that it includes nearly $2 million to study the impact of high-potency pot on young people and to launch an education campaign. The bill is in committee at this hour. More than 240 people have signed up to testify, most of them in support. Live at the Capitol, Sean Boyd covering Colorado First.